Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Of course, thanks for having me.
My pleasure. My name is Dilshad Burman. I am a writer and reporter with City and 680 News. And if you haven't tuned into one of our sessions before, the way this works is we have been collecting questions for the doctor over the past week, and we will be presenting them to her today. She's never seen them before. It's all off the cuff. If you haven't had a chance to submit your questions to our website or through our social pages, you can still do so in the live chat in this broadcast, and we will try to get to as many as we can in this short 30-minute period that we have with the doctor. We are going to start today with the cached questions that I have over the week. Usually we start with vaccine questions, and then we'll move on to some other generic questions because vaccines are still top of mind for most people. So doctor, are you ready to go?
Yeah, let's go.
Excellent. Let's get started here with the cache of questions that I have. We'll start with Sandra. Sandra asks, Canada needs a vaccine for those of us who are allergic to PEG. What do we do? I had a Pfizer shot for my first round of vaccines, and I'm waiting to see an allergist for a recommendation for the second shot.
Yeah, so this is a really good question. If you actually have had a severe allergy to either a component in the vaccine or to one of the vaccines, what are your options? I do know in Ontario that there are allergists that have actually been able to safely immunize people who have had severe allergic reactions to PEG specifically. So would definitely recommend that you follow up with the allergist. They can often do tests, provide the vaccine in a safer way. They have a number of medical ways to be able to address this, and it doesn't always mean that you cannot be vaccinated even if you have an allergy, but you do need to see an allergist.
And doctor, do the allergists then administer the vaccine like under some sort of supervision, something like that?
Yeah, so one of the methods that they can use is under controlled circumstances. They can give you the vaccine, they give you a little bit, see if you have an allergic reaction. If you don't, proceed to give you some more. Sometimes they can give you medications before you have your shot as well too. So yes, they can certainly vaccinate under controlled circumstances or arranged for you to have that.
Right, absolutely. Okay, and then Lax Gibb asks, if there is an excess of vaccine that is going to expire, can I get a third shot?
If a vaccine is about to expire, no, you can't get a third vaccine. Right now, there is no recommendation in Ontario for a third dose of vaccinations. So this is being looked at. Actually, really globally, there is no recommendation for healthy people to get a third dose of vaccine. Where it's being looked at is actually for people who may have a weakened immune system, maybe they're elderly, and that's under active being looked at in Ontario, but not just because the vaccine is expiring.
Right. I don't even know how you would find out that, a certain pharmacy has expiring vaccines, so run over and get a third shot. I don't know how that would work. Fergus asks, is it safe for a person, I'm not sure if I'm going to pronounce this condition correctly, but let me try. Is it safe for a person with cavernous hemangioma in the brain to have a vaccine?
So I think if you have a very specific medical question, you're best off talking to your family physician or your medical specialist about it. For the messenger RNA vaccines, having hemangiomas, even strokes, clots, those are not considered contraindications to being vaccinated in general. And for your specific medical condition, I would absolutely recommend that you talk to your doctor about it to get your specific question answered.
Right, absolutely. And then Wings asks, Wings is our regular contributor. They ask, are the daily provincial new COVID-19 cases and deaths differentiated between vaccinated and unvaccinated? They say if these details are provided, perhaps the vaccination rates will go up.
Yeah, so actually they are available, and they're going to actually become more readily available. In Toronto, we're looking at ways to have it more accessible, just as Wings has said. What we know so far is based on the Delta variant that's spreading, in the past couple of weeks, that only less than 10% of people who have gotten sick from COVID and from the Delta variant were doubly vaccinated. But the vaccines are still doing very well, even with the Delta variant.
Okay. And then this one comes from Anonymous. Some say get vaccinated to protect others, especially your children. Others say vaccinated people can still spread the virus while not showing symptoms, which may be worse because then they don't know that they have it and they can't isolate. So do vaccinated parents protect their children or themselves?
If you're vaccinated as a parent, the likelihood that you're going to get COVID and bring it home is much reduced. It's actually 8 times less likely. We know that you're 8 times more likely to get COVID if you're unvaccinated. So absolutely, it helps to protect your children. There is, again, I said that small chance that if you're vaccinated, you could get COVID. Again, the symptoms are milder. So even if you're vaccinated and you have a symptom, you should still get tested. If you were exposed to someone with COVID, get that test as well too, to make sure that we don't spread it to children. But again, most of the children who are getting COVID are getting it, like I've heard from some of my colleagues who are doing these investigations, in families where even the parents are unvaccinated.
Okay. So, okay, that makes sense. Sorry, we have a few live questions coming in here from our website. Let's go to Rain's question. They ask, are there any updates on the WHO guidance on mixed vaccines?
So interchangeable vaccines like we have for messenger RNA vaccines, yes, this discussion is still ongoing. I don't have any new updates to provide except to say that, I mean, the World Health Organization certainly wants as many people to be fully protected to help with this pandemic, for sure.
For sure, okay. And then more questions here coming in on our website. Faith asks, what are the details of the breakthrough cases? Age, gender, health, how were they infected?
Actually, on our Toronto Public Health website, we actually have all of this detailed there. You can actually divide it by the last week through the whole pandemic. It will divide it out by males, females, by age groups. We are seeing that some of the younger age groups in children, in young adults, that the COVID infection rates are increasing. Some of the older individuals, 70 plus, the rates haven't gone up as high.
And doctor, is that in vaccinated people? Is there a differentiation on the website made between those who are vaccinated and unvaccinated?
That is not readily available just yet. It is on Public Health Ontario's website, kind of in some documents, but we are working on being able to make that more clear. I think it's still important to know that the vast majority of cases are still in the unvaccinated. Okay.
And then Lorna asks, is it safe to be around non-vaccinated people if you are fully vaccinated people? So I guess if you're fully vaccinated, is it safe to be around unvaccinated people?
So the Public Health Agency of Canada has put out guidance. If you are vaccinated, what can you do? And talks about how if you are in indoor crowded settings with unvaccinated people, even if you're vaccinated, you should wear a mask, keep your distance, because that risk is there. We do know, like we've been talking about, that when you're unvaccinated, the risk of you getting COVID and spreading COVID, getting very sick from COVID, is much higher.
Right. And let's take a live question here from YouTube. Julio asks, are people who are immunosuppressed getting a third booster dose?
So this is something that's being actively looked at around the world, actually, because we know that people who are immunosuppressed with the 2 doses of vaccine didn't mount the best immune response. And I'm not just talking about antibody responses. I know some people think, oh, I'll just get an antibody test and see if I'm protected. The antibody tests are not the best way to determine it. There's also T cells, like we've talked about it. There are other immune responses. And yes, immune compromised people are not getting that best overall immune response. And so maybe they should be recommended a third dose. It's almost like a completion of the series, that they need 3 doses and other people need 2 doses. But that guidance just hasn't come out yet, but is under people around the world, including in Ontario, including in Canada, are looking at this.
Right, absolutely. And more questions here from our website. JM asks, are there any trials and safety data available regarding administering the third booster dose?
So there are some studies that have been done, especially in immunocompromised individuals, showing that a third dose can act to enhance the immune response, and haven't found any safety signals. Again, we know with safety signals, sometimes you have to give the vaccine in the millions in order to detect any kind of rare situations, but there have been no safety concerns identified either.
Okay. And let's take some more live questions. RM asks, this is again from our website, Doctor, are you able to provide some insight as to why more fully vaccinated people are reported to be infected versus the partially vaccinated? In the numbers reported by the Ontario government, it now breaks out the infected based on vaccination groups, and RM says they don't immediately understand why there are more vaccinated people who are infected rather than partially vaccinated people.
Okay, when I looked at the data just the other day, fully vaccinated, the proportion of people who got COVID who were fully vaccinated was still lower compared to partially vaccinated. So I know the data is tough to understand. I think what we do need to realize, though, is as more and more people get fully vaccinated, if there are breakthrough cases, it will be in the fully vaccinated. So we have to look at more than just the numbers of COVID in fully vaccinated. We also have to look at their severity, because I have investigated some cases just this past week, fully vaccinated, very mild symptoms, like only detected COVID because they were getting screening testing for other reasons, actually.
Right, absolutely. Lots of live questions. Okay, let's take another one. This is from Anonymous. How many kids without underlying issues are hospitalized in Toronto? I don't know if we have numbers based on that.
So the COVID hospitalization numbers should be available through Public Health Ontario. I certainly can't speak to active right now. There are less children who have been impacted overall by COVID, including being hospitalized. Nationally, there has been though an increase in pediatric hospitalizations related to this Delta variant. It's certainly something to keep a very close eye on, because we're seeing in other parts of the world, like in the US, where some children are getting quite ill from this Delta variant.
Right. And a couple more here from our website. Let's take this live one from Sunshine Cam. What about people with severe allergies? I'm allergic to aspirin. Is it advised that I should be vaccinated?
Absolutely. Aspirin is not a contraindication to be vaccinated. And if that's your only allergy, you could safely be vaccinated.
Okay. And then SK asks, there are several anti-COVID nasal sprays in development, such as the nitric oxide spray being made by Sanitize in BC, and it's said to kill 99% of the virus in the upper airway. Assuming this works, what could life look like if something like this was made available across Canada, universally adopted? I'm assuming, would restrictions ease? Would we be able to go back to life as normal?
Yeah, it's a good question. I think it's really compelling to see what future technology or medicines may be available to either treat or prevent COVID. And, nasal cleansers have been around for a while. Some people swear by them in terms of not getting sick with respiratory viruses. We know that COVID tends to sit at the back of the nose. It tends to replicate there. So I guess the question is, would these nasal sprays get to the way back of the nose? If any of you have had one of those nasopharyngeal or the real deep nasal swabs, they go much further than a nasal spray goes. So I guess we'll have to wait to see what the data shows in terms of the effectiveness of these interventions.
Yes, absolutely. I put my hand up because I use those nasal sprays, but that's just for allergies, and they go nowhere near that far back. They're just about here, and that's where they stop. Yeah. Okay, let's see some more. Oh, we've got a question coming in from Twitter. Why are masks required for non-vaccinated people if the vaccination doesn't stop the spread, basically?
So masks they're not required everywhere. I mean, if you're outdoors, it's not necessarily required. It's really, we have to think about those higher risk situations where COVID can spread, and recognizing we're, first to say that the vaccines are our best intervention, but two are not 100%. And so if we still have a crowded indoor environment, poor ventilation, a lot of people, not everyone is vaccinated, COVID can really spread quite quickly in those settings. And that's why we still are recommending masks in those settings, including in schools, for example.
Right. And then another one from Twitter here, Bry IT Guy asks, how much impact does prolonged use of masks affect the lungs' ability to receive air and oxygen?
There are no studies that I'm aware of that have shown that the mask usage that we've been doing for well over a year, I think it's a good kind of population-based study. Using masks overall much higher in the population. Have we seen more lung issues, oxygen saturation issues in the public, in the community? And I'm not aware of that. So I think we have to recognize that masks can play a role to help prevent the spread of COVID. COVID can certainly impact our lungs in very, very challenging ways.
Absolutely. Okay, that's it for the live questions for now. So I'm going to go back to our submitted cache here. Jules asks, when will we get the Johnson & Johnson vaccine?
So the Johnson & Johnson vaccine has been approved in Canada since the spring, actually. We had a shipment come to Canada, but it didn't pass the quality standards, and so that vaccine was not used. So we haven't had another shipment of vaccine. I'm not sure if there's anticipation to receive some or what the timeline would be for that. But it would certainly have to pass the quality standards, even though the vaccine is approved as well.
Right. That's actually really reassuring that even if it's approved, once it gets here, there's testing involved. And if it's not good enough, they don't release it to the public.
Yeah, exactly.
Okay. Faith asks, what is the advice for vaccinated diabetics? Are they still at risk, especially if they have vaccinated children attending school?
So I think, COVID is spreading. We talk about, a fourth wave coming. I mean, I think there's someone who has diabetes is higher risk for COVID, and it's super that they're vaccinated and that the people around them are vaccinated. That will help to protect them. But I think for someone who is at higher risk for COVID, you want to consider some of those other layers, like when you go out, to wear a mask, to keep a physical distance. And if you have kids who are attending school, making sure that if they have symptoms, getting them tested right away.
Right. And then Ryle asks, there were reports out of Israel of people getting shingles after the vaccine. Has there been any cases of that in Canada or the USA?
I'm not aware of that, about shingles being caused by the vaccine or shingles being occurred following the vaccine. That being said, the information nationally is posted on the Public Health Agency of Canada's website. And so I'll certainly check it before our next week's call, but encourage our viewers to check it there as well too.
For sure. And then another question here, when do they expect to have more data on the reports of myocarditis after the vaccine? Do we have more information on that?
Yeah, so that's something that's actually being posted, I think weekly or every other week in Ontario through Public Health Ontario, and nationally through the Public Health Agency of Canada. The reports are still showing consistently that it's occurring in males, in young males, so in either adolescents or young males, mostly after the second dose, and then looking at the different vaccines as well too.
Right. And doctor, you had mentioned that when it comes to vaccine-induced myocarditis, if at all it is connected to the vaccine, it seems to be very mild and can be treated with medication, correct?
Yeah, exactly. So it tends to occur within the first week. The symptoms are mild, but if you have symptoms, you should go and get tested. There's a blood test and an electrocardiogram, sometimes an ultrasound or an MRI that can be done. But so far, people who are getting it, even in Canada, while it sounds serious, it's actually considered mild if you talk to the cardiologist. The heart resolves itself. There doesn't seem to be any long-term effects from it. And then you have that protection from COVID. So that is also a really important point. So thanks for raising that.
Right, absolutely. And then, okay, LT asks, I have a 1 and 3.5-year-old starting daycare and kindergarten in September, respectively. How quickly will vaccines be available for them? Because I'm terrified that they're going to get COVID from their classmates. Do you see there being pressure from pediatricians on Health Canada to maybe authorize Pfizer for all ages sooner?
Okay, well, I think we don't want to authorize a vaccine unless it's been properly studied. I mean, we want a vaccine for children, but we don't want to just say give it to them because they need it. We want to at least make sure that it works and that it's safe. So let's wait for those clinical trials to be done. We know that Pfizer is working on them right now, for example. It could be sometime in the fall, maybe October or so, that they might apply for an application to Health Canada. So sometime in the fall, hopefully, we will have a vaccine. The first one might be for the 5 to 11-year-olds. So the 1-year-old may still have to wait until the new year. But I personally wouldn't recommend rushing the approval because I want to make sure that when we give a vaccine to children, just like for adults, that it's safe and that it works.
Yeah, absolutely, absolutely. And I wouldn't want to feel like Health Canada was pressured into doing something because then it sort of erodes public trust even in that kind of an institution, I would say.
Yeah, exactly. That because I know people have questions. Was due process applied?
Yes.
Did they cut corners? Right? Yes. And there's no cutting corners here.
Yeah, absolutely. And another question coming in live on our website here. We just talked about third doses, so let's address this directly again. Aaron asks, why don't all people just get a third dose as an additional protection?
Well, I think before we recommend a third dose, we have to first show, first of all, is it actually going to work? Or, you know, if we already have 90% protection from the 2 doses, do we need to get, if we get a third dose, will it take us to 100%? There's no guarantee for that. And so I think we need to also recognize maybe not everyone needs a third dose. Maybe just a few group of people need it. Also, what would be the interval? Like maybe you need a third dose 2 years later and not right away as well. And we also want to make sure that it's safe. We don't want to just recommend a third dose and find out actually, you know, maybe there was a better option that we could have chosen.
Yeah, absolutely. And I think there is such a thing as too much of a good thing. We don't know if like that third dose is going to increase side effects or, you know, have some other adverse effects, right?
Yeah, exactly. So I really love the enthusiasm from the viewers today. And, you know, I think we all want to get rid of this pandemic. But I think the first step right now is get everyone who isn't vaccinated. Like let's do our research on the third dose, but if we can all just find someone who hasn't been fully vaccinated, hasn't even gotten a single dose, I think that will help all of us a lot more right now.
Absolutely. And I think we've talked about this before, Doctor. It's more about, you know, we say like, who can you talk to, who can you trust in terms of getting vaccine information. And a lot of the times it's your peers and people that you sort of have in your life rather than necessarily official sources, which a lot of people do sort of distrust, right?
Exactly. It's that personal connection that is actually so persuasive.
Absolutely. Okay, we have a few minutes, so I'll keep going with our submitted questions, but you can still submit live questions if you need to. Let's see. Okay, Sam asks, and I believe this was a question from last week's YouTube that we didn't get to. Sam says, my brother has MS and I think he takes immunosuppressing drugs, Tysabri regularly every month. He got his first dose of Pfizer on May 5th, second dose on June 11th. Is he protected well enough? How can we know?
Okay, so the best way to know that you're fully protected is actually that vaccination record. So you have that record, and that means that you're fully protected. Again, those who have an immune compromising condition, this is being looked at, whether some of them need a third dose. I think some of the research is showing maybe in transplant patients, maybe not everyone. I think there is some research that some people with health conditions actually still got a very good response after 2 doses of vaccine. So for now, what I would say is hold on to that vaccination record. That is your best way to kind of be confident that you have protection against this against COVID.
Right. And Doctor, later on, we've got a couple of questions regarding the antibody testing. In such a case, when somebody is immunocompromised, would you suggest taking an antibody test just for like peace of mind to know that, yes, my antibodies have kicked in?
Not at all. No, I do not recommend it. No, I do not. And the reason why I don't recommend it is because the antibody tests that are available are not always the right test to be able to show that you have immunity. Right. Because as I said, there's the antibodies, there's the T cell response, like there's lots of other immune responses beyond the antibodies. And so if the antibody test is negative, it doesn't necessarily mean that you're not protected from the vaccine.
Right, right. And then we'll just squeeze in a couple more questions. Willowdale Girl asks, why are nursing home employees not required to be vaccinated against the coronavirus while working with 85-year-olds who are most at risk of dying from the virus?
So right now, the Ministry of Long-Term Care has a policy that says that you either have to show proof of vaccination or take an education session if you choose not to be vaccinated. That is, I think we certainly do recognize that in those settings, it would be the best to have everyone, the staff and the residents, fully vaccinated. But that currently is what the policy is that's in place through long-term care. That being said, if there is an outbreak in that long-term care home on that floor, the staff who are unvaccinated will have to be excluded, right, whereas the staff who are vaccinated can continue to work.
Right, that makes sense. Yeah, yeah. And then one last question here. Is there anywhere to see among the daily confirmed cases, what is the percentage of fully vaccinated, partial, or non-vaccinated, particularly over the last 7 days? So I think we just addressed this, but perhaps we can do it one more time.
Yeah, so it is available on Public Health Ontario. They have a document where that information is available. As I said, we are working from Toronto Public Health to be able to get that kind of more accessible on our website. Essentially, people who are getting COVID, more than 90% getting the Delta virus, are unvaccinated, and less than 10% have either been fully or partially vaccinated. So, you know, I totally agree that having that information more accessible will be helpful. And I'm sure in the coming days that will be more available, though it is available now.
Right. Okay. And that brings us to 1 o'clock. Wow, that half hour really just went by really fast. Thank you to everybody that submitted your live questions. Thank you, Doctor, for taking the time, having the patience to answer all of these questions for us. If you didn't have a chance to submit questions today, we're going to be back with the doctor next week, back here on YouTube and our website. So we'll get to them then. Thank you so much, Doctor.
Okay. Thanks so much. Bye, everyone.
Bye-bye.